So the external examination, this is the physical examination of the evidence of any change, any evidence of any injury, evidence of any therapy. Don't speak. And internal examination is correlation of the external findings within interior after opening the body cavities. And you examine each and every viscera, complete scrutiny, and specimen are collected if they are indicated. Then finally the closure of the body, handing it over to the police. Because you have received the body from the police, you will hand over to the police, and police will then forward the body to the hires. Then external examination, the clothes examination is most important. Because there may be evidence of injury, there may be evidence of any material, any trace evidence, any tears, cut marks, broken buttons, holes, any finding which is on the clothes is to be examined. And then external examination of the body. General physical examination, height, weight, build, sex, color, race, those general parameters regarding identity. And changes which appear after death, postmortem changing, because they help us in determining, in estimation the time between death. Then external on the body, any mark of injury, any mark of surgical intervention or medical intervention, they are noted down. The examination of clothes, just we completely examine clothes when they are dressed on the body. From the front, back, side, every corner is looked on, and after examination, you mark the clothes with your PMR number. PMR number is basically the application of the doctor, the case number, the yearly number, and the year, and it is handed over to police as case number. Now the external examination of body, and there is important instruction that all the hidden areas are especially should be searched for, because there may be injury, and those hidden areas are usually the orifices, the nasal orifices, the ears, the eyes, the inner canthus, the axilla, the umbilicus, vaginal and anal canals. So these are those hidden areas which are routinely not examined, but instruction is it should be detailed, scrutinized. And inspection should be on all the sides, front, back, sides, all the sides of the body should be carefully examined. Not only with the naked eye, but with the magnifying lens if it is required. So, evidence of any injury, because when we look at the injury, by our knowledge of traumatology, physical damage to the body, we can tell that this injury is a lacerated wound, this injury is an incised wound, this is a gunshot wound. So, we will determine how many number of injuries, what type of weapon may have been used, and then mark them on the autopsy report. Then evidence of any therapy, they should be separately handed on the document, because there may be surgical intervention, there may be stitching, there may be cutting, there may be laparotomy, wound, thoracotomy, tracheostomy. All those surgical interventions should be mentioned in therapeutic intervention, surgical intervention, not under injuries. So finally, when you will draw the conclusion, you will comment upon the injury, not on the surgical interventions. This is general physical examination, age, sex, race, height, weight, build, these are all noted down. The visible changes, these are changes after death, the cooling, the rigor mortis, the postmortem statement, they help us in estimation of time since death. Another physical changes like jaundice, cyanosis, we are all noted down. And all the injuries, they are noted for its size, shape, depth, margins, angles, and location. Vital reaction. You will comment upon the injuries are ante-mortem, A-N-T-E, before death. That means these injuries were inflicted when the person was alive. So you will comment upon the nature of injury, that is ante-mortem, because post-mortem injury will not be classed under the injuries. So injury will be commented upon. Vital reaction, and they are in reference to the anatomical landmarks. So front of body, the midline, the costal line, the middle strap line, the shoulder angle, so these are the anatomical landmarks, and you will place them the distance from those anatomical landmarks, from the back, from the sides. There will be single injury, there will be multiple injuries, and if they are more than one, you can group them together. A complex of 2 injuries, complex of 3 injuries, 6 injuries, 9 injuries, placed on the front of the chest, placed on the front of the abdomen. So you can group them together. These are various weapons, and they will be inflicting their physical effect on the body when they are applied. Now the external evidence of therapy, as I told you, you will record all the surgical interventions. Therapeutic. Incision, dressing, drainage hole, catheters, stitches. You will comment upon the nature of stitch, which material is used, and how many stitches were applied. Tracheostomy, needle punctures, so all the interventions they are noted. Now the internal examination. Internal examination will be with the incisions. They are classical incisions for the opening of the body. And this is to visualize the interior of the body for any disease process, for any injury, for any surgical intervention, or the therapies they are looked for. And collection of biological fluid, the blood, or the material, the viscera, or the labs if it is indicated. So the therapeutic intervention is also. And precaution is that whenever you are going to open the body, for example, if there is asphyxial elevation, that there is interference with respiration at the level of the neck, then your primary focus will be on the neck, and you will like to have a bloodless clear field. So first you will open the skull, then the chest, so that the blood is drained from head and the chest, and finally when you will dissect of the neck, it will be a clear field. So the objective of opening the skull will be depending upon the case, the type of allegation, and this is the decision of the autopsy center. He has to open the 3 cavities, but the decision which is to open first, this is the decision of the autopsy center. Now regarding the autopsy incisions, first they are primary incisions. Primary incisions which are made first. For example, for opening the head, it is a classical incision from one mastoid process across the vertex to other mastoid process, and it is skin deep. So this is the primary incision for opening the skull. Then for opening the chest and abdomen, they are opened in one incision. So one incision, eye shape, starting from the chin, straight in the midline, avoiding umbilicus to the pubis. Or it can be a V shape starting from the both mastoid process, coming medially, joining in the merobrium sterni, then in midline going down. Or it can be a modified Y shape starting from the tip of the shoulder, going down and medial to the zipisternum and then down in the midline. So these are various primary incisions for opening of the cavity. For opening the skull from mastoid process, one mastoid to other mastoid across vertex. Then incision for the neck, it can only be a V shape from the mastoid joining in the merobrium sterni. And for chest and abdomen, either it is I shape or it is Y shape or it is a modified Y shape. So this is how from one mastoid process across the vertex to another mastoid, and these two scaffolds, they are reflected forward and backward. And this is the eye shape from chin to tube, and the skin is reflected. And this is Y shape, starting from both the mastoid processes, joining it is the zipisternum and then going down. And this is a modified Y shape, starting from the tip of the shoulder, going down and below the umbilicus, below the nipples, and joining in the midline at the zipisternum, then going down in same I shape. Then there are secondary incisions which is opening for the cavities, and for that, if it is for the skull, then cranial cavity, cutting of the bone, cutting of the calvaria, that is the second incision for the skull, and cutting of the sternal plate along the costal margin is the second incision for opening the chest, and tertiary incision when you enter into the cavity, like the opening of the skull, you remove the meninges. This is the tertiary incision. For opening the lungs, you will remove the pleura, and abdomen, you will remove the peritoneum. So these are tertiary incisions when you are going into the cavity, approaching the viscera. Then there in the quaternary incision, this is for individual organ, lung or brain or heart. These are at fourth level incision. And sometimes the incision for the limb, in routine it is not done, but if it is indicated, you will suspect something, then these are circumferential incision high up. On the upper arm, just below the shoulder, and a circular incision, you reflect the skin downward. And for the lower limb, it is top of the thigh, circular incision, and you reflect the skin downward. So these can be, if it is indicated, not in routine. For the opening of skull, you will see how it is open. This is a midline incision being made from one mastoid to another. Then both the scaffolds, they are reflected, the forward towards front and the backward towards the back. This is how they are reflected. And then the skull cap is exposed. The temporalis muscle, it is not cut, it is just removed with blunt dissection of the skeleton, not it is cut, it is just. Then this is the second incision, cutting of the skull with the hand or the electric shock. A circumferential cut is made this. And with the chisel you will remove the skull cap. This is the skull cap being removed, and these are the meninges and brain. When you remove the meninges, the brain is exposed. This is the base of the skull. You will remove the brain and examine the base of the skull. For the neck, body is placed on a wooden block so that the neck can be extended. And a V-shape incision starting from the western processes, joining in the midline, like this, on both the western processes, and you can see a clear field. You will examine all the muscles, the thyroid, the vessels, and you can see there is a bruise here. So clear examination of all the contents you need. And for the chest and abdomen, midline, U-shape, Y-shape, and avoiding umbilicus. This is important. And why we should avoid umbilicus? Number one, it is for the cosmetic reason. It will disfigure. Secondly, it is a fibromuscular structure. It is hard to cut, and again, it is hard to stitch. So that's why the midline incision, when it is coming, it is going around the umbilicus, not cutting it. Because some concealed injury may be there, and you have to examine it also. This is important. Sometimes you are suspecting a case of pneumothorax. For that, when you give the incision for the chest and abdomen, a midline incision, and the skin is reflected like a flap, like this, and here you will pour water. Body is supine, a flap is reflected, you will pour water here and give a thrust of the scalpel into the chest cavity, and if there is area, it will bubble up. जो टेस्ट लिखे हुए वेरियस बुक्स में जी इन्वर्टेड सिलेंडर रखें, दैट इज नॉट पॉसिबल. बॉडी के ऊपर सिलेंडर नहीं रख सकते. कर्व कॉस्टल मार्जिन है, वो वाटर स्टे नहीं करेगा. सिंपल टेस्ट है, जस्ट रिफ्लेक्ट द स्किन लाइक अ फ्लेयर, pour water here and thrust with the thrust of the scalpel, the air will gush out. So for the pneumothorax, if you are suspecting, before entering into the chest cavity, you will test for the pneumothorax. This is how the flap of the skin has been reflected in this the cavity. Here you will pour water, and with the scalpel you will cut open it. This is the costal plate. Along the costal cartilages, they are cut, and the sternal plate is removed. And this is the sternal plate removed, and now you can see the chest viscera and the abdominal viscera. And again, then there will be, if you are suspecting air embolism. So before opening any other viscera in the chest, you will fill the pericardial sac with water. If you are suspecting air embolism, you will fill the pericardial sac with water, and with this scalpel you will thrust the right atrium, because air will be entering into the right atrium. When there is air embolism, air is being sucked from the peripheral vessel going into the right atrium, and there air is being churned up, mixing up. So air bubbles are there. You will thrust the right atrium after filling the pericardial sac. How will you dissect the body for pneumothorax? Stand up. If you are suspecting pneumothorax, what you will do? Here होगी कहाँ? इस एयर कहाँ से निकालनी है। कैसे? एयर एम्बोलिज्म इज वेरी कॉमन। हॉस्पिटल में आप अनअटेंडेड आईवी लाइन चल रही है, अगर ड्रिप खत्म होगी तो एयर इज बीइंग सक्ड इन एंड समटाइम इट कैन बी वेरी लीथल। इट कैन लीड टू एयर एम्बोलिज्म बिकॉज एयर लॉक हो जाता है। बिकॉज pump is a machine, heart is a pumping machine. When there is air lock, air bubbles are sucked in, they are churned up with the blood, and the pumping will not be possible. So air embolism is common happening, common cause of death, which is missed in the clinical ward. And we see at autopsy when the patient, so the disease is received from the hospital, air embolism is there. So this is very important. Whenever you are injecting, be careful. Immediately stop the IV line when the fluid is over. So air embolism is to be dissected, checked at autopsy, and you will fill the pericardial sac with this syringe. Now this outside the heart is filled with blood, and simply you will thrust the right atrium. Air will be there, and it will bubble up. So you can confirm that this was air embolism. Then for the chest and abdomen, same I discussed the I-shaped incision, the thoracic, you will examine the abdominal viscera. Each viscera is examined, each cavity for its contents. So this is the midline incision. You can see the damage here. So internal examination for evidence of injury, evidence of therapy, and systemic review. After you have noted on all the injuries and the signs of therapy, you will overview. Nothing should be left. Or once you missed anything, it is gone forever. Body is staged, and you go to police, gone for burial, and you cannot then rectify that. So systemic review, looking for pathology, collection of viscera if it is indicated. All the evidence of injury, they are correlated internally. This is the damage to the liver, lacerated zone, laceration. Then the evidence of therapy, all the surgical repair, cut work, anastomosis, splenectomy, nephrectomy, whatever they have done, you will note it down. And you will mention what the procedure have been done. And systemic review, I told you, you will detail, go through. After you are examined, you will eviscerate from neck to the pelvic structure and mass. They are eviscerated, put on the table, and you will examine each organ separately. This is the whole from neck to pelvis or visceral area. Then collection and recoveries, which are part of the protocol, and they are handed over to us. And they are either from the clothes, when you are examining clothes, physical evidence, biological fluid, non-biological, any bullet, any glass mark, or anything which you find on the clothes or on the body. Any stain, any nail, any hair, that is okay, and it goes to police. Similarly, internally, the biological fluid, the blood, the semen, the saliva, they are collected. Viscera for histopathological and for chemical examination, they are collected. And foreign body, the bullets, if they are found within the body, they are recovered, they are sealed in a container and handed over to police. For chemical examination, viscera in routine, there is a set protocol once viscera are sent to chemical examiner for detection of drug or poison. There are 4 bottles. In first bottle, you will place stomach with its contents, complete stomach with its content. You will cut, ligate both ends and put it in the bottle, open it and examine the contents and will send to the chemical examiner. Bottle number 2, piece of small intestine, roughly 50 to 100 centimeters. It is cut and put. Then in the third bottle, piece of liver with gallbladder, piece of spleen and half of each kidney or 1 kidney. Piece of liver, piece of spleen, half of each kidney or 1 kidney as a whole. And the fourth bottle, you will send preservative. Which preservative you have used for chemical examiner as a control, it is sent. कौन सा प्रिजर्वेटिव भिजवाते हैं केमिकल एग्जामिनेशन में? यूज कौन सा होता है? फॉर्मलिन इज अ केमिकल एग्जामिनर का बेहतर फॉर्मलिन फैक्ट हो गया है. Saturated saline, super saturated saline, you will not induce any chemical, alcohol, spirit, formalin, no. Super saturated saline. This saturated saline also preserved. It will extract water from the tissue, they will get dehydrated and preserved. So fourth bottle will be preservative. Stomach with its contents, piece of small intestine, piece of liver with gallbladder, spleen, 1 kidney or half of each kidney, and sample of preservative which is supersaturated saline. Then for histopathological, they are in hormone saturated saline. Now you have to fix them up because they are going to do histopathology, no chemical. So supersaturated saline plus formalin, 10% supersaturated hormone saline. So 10% formalin डालते हैं supersaturated saline में for histopathological examination. The viscera, they as a whole are sent to the histopathology. So all these recovery they are listed, they are noted down and handed over to police. Then body is stitched as normal as you can. Sometimes the body is extensively mutilated, extensively damaged, and you will try to reconstruct as normal, as close to normal as you can. So fine stitching is done. This is stitching and this is the final. Then opinion is the conclusion. Finally, conclusionary remarks which are the main observation by the police. And it includes, you will comment upon the nature of injury. Nature of injury, anti-mortem or post-mortem. कि मरने से पहले की थी कि मरने के बाद. You will comment upon nature of injury. Just by looking at injury at autopsy, how you can decide this injury is anti-mortem? Anything else? Vital reaction. क्या vital reaction होगा? और पोस्टमार्टम जो कट होगा ब्लड तो उसमें से भी निकलेगा, वैसा में से ब्लड निकलेगा. What will be the difference? वो भी ब्लड stain. The antemortem blood when it pours out, it stains the tissue. The postmortem blood निकलेगा, it will not stain. वो this flow of हो जाएगा. इसके सिंपल एग्जाम्पल डेली आप किसी ने चिकन खरीदते हैं आप नेक के ऊपर एक कट का निशान होता है, उसके ऊपर ब्लड चिपका होता है, when you wash it doesn't wash it, you have to cut that portion. और बाकी जो पीसेस मीट के बिल्कुल वाइट होते हैं, किसी के ऊपर इस तरह के स्टेनिंग नहीं, they are postmortem and that is antemortem. So simply at autopsy you will wash it with water. If it will wash it in postmortem, if it doesn't wash it in antemortem. So simply you can find it out which is antemortem and postmortem. Then kind of weapon, blunt, sharp edge, वो आपकी traumatology के knowledge से you can just look at the injury and you can decide this is antemortem, cut wound or lacerated wound or gunshot. Then medical cause of death, we have discussed it. Medical cause of death is the chain of events. The injury leading to a chain of events, cut wound into the heart, leading to profuse hemorrhage and shock in the terminal. This is the medical cause. Then the mode, leading to asphyxia, leading to syncope, leading to coma. So that is three modes. That's a three-vital system with a team mode. Manner of death. Natural death है, unnatural death है, homicidal है, suicidal है. This is the job of police, but you can estimate. You can give a suggestion. You can seek the help of police. आप उसके discuss कर सकते हैं. You can comment upon the manner, but in the routine, when we give the opinion, we just it is suggestive of. We do not give a direct opinion. It is suggestive of being suicidal. It is suggestive of homicide, not directly we comment upon. टेस्ट है आपका इसके बाद? Yes. टेस्ट की तैयारी कर लेते हैं, हम पहले बताते हैं. Then time between injury and death, उसकी knowledge of anatomy से which organ is damaged, which vessel is damaged, how much time the person may have alive, so the volitional activities he could have performed. Then the time between injury, postmortem and death, that is the postmortem interval. So we study in the rate method or the chronicles method and we estimate the time. So the remarks which are usually given, injuries stated above are antemortem. जो आपने इंजरी ऊपर लिखी है, injuries stated above are antemortem and are caused by sharp edge weapon. आपने nature of injury भी दे दी, antemortem, आपने weapon भी दे दिया, sharp edge weapon. And the cause of death in this case is perforation to the left ventricle of heart. The cause of it, leading to massive hemorrhage and shock to motor. So this is the opinion in which the health or police authorities and the court is interested. They just read it out. Your conclusion is more detailed autopsy report नहीं देखते. The injuries stated above are antemortem. ये लाजमी है कि बंदा जिंदा था जब चोट लगी, antemortem injury थी, and the cause of death in this case is damage to the heart with the sharp edge weapon. So weapon and the damage. And this injury is sufficient to cause death in ordinary course of nature. मकसद ये है कि ये इंजरी ही उसकी cause of death है, not anything else. You are certifying that this injury is sufficient to cause death in ordinary course of nature. Thank you.